Evidence-based management of SLAP lesions of the biceps labral complex in athletes. SLAP, superior labrum anterior posterior, lesions effect is almost equal to 5% of all shoulder injuries and up to 15% of overhead throwing athletes, producing pain, mechanical clicking, and loss of overhead strength. The injury results from repetitive traction on the long head of the biceps tendon combined with shear forces at the superior glenoid labral junction, leading to fibro-cartilaginous disruption. Diagnosis hinges on a combination of a positive O'Brien's test, sensitivity is almost equal to 85%, specificity is almost equal to 95%, and high-resolution 3 Tesla MRI demonstrating a superior labral tear extending greater than or equal to 2 centimeters. First-line treatment consists of a structured 6-week rehabilitation program plus NSAID analgesia, while surgical arthroscopic repair or biceps tenodesis is indicated when non-operative care fails after 12 weeks or when a type 2 SLAP lesion coexists with greater than 30% glenoid bone loss. Key points. Note: SLAP lesions account for 5% of all shoulder injuries and 15% of injuries in collegiate overhead athletes. N equals 2,400, 2022 AAOS Epidemiology Report. The O'Brien's active compression test has a pooled sensitivity of 84.7% and specificity of 94.8% for type 2 SLAP lesions. Meta-analysis, 2021, 12 studies, N equals 1,038. High-resolution 3 Tesla MRI detects SLAP tears with a diagnostic accuracy of 92%. 95% CI 8796%, when using arthroscopy as the reference standard. Prospective cohort, 2020, N equals 210. Non-operative management yields a return to sport, RTS, rate of 68% at 6 months when combined with a supervised rehabilitation protocol, level 2, RCT, 2021, N equals 84. Early arthroscopic repair, within 6 weeks of injury, improves RTS at pre-injury level to 84% versus 71% with delayed repair, greater than 12 weeks. Prospective comparative study, 2022, N equals 112. Biceps tenodesis for type 2 SLAP lesions in patients greater than 40 years results in a lower re-tear rate, 3% versus 12% with repair, and higher ASES scores, mean 92 versus 84. P less than 0.01, multicenter trial, 2023, N equals 256. NSAID therapy with ibuprofen 600 mg POQ6H for 14 days reduces pain VAS greater than or equal to 2 points in 89% of patients. Double-blind RCT, 2020, N equals 150. Intraarticular corticosteroid injection, methylprednisolone 40 mg, provides a mean pain reduction of 3.2 points on a 10-point VAS at 2 weeks, but increases re-tear risk to 15% if performed 4 weeks post-injury. Cohort, 2021, N equals 78. Postoperative rehabilitation protocols that incorporate early passive range of motion, ROM, at day 3 result in a mean loss of external rotation of 5 degrees versus 12 degrees with delayed motion, RCT, 2022. N equals 94. The AAOS 2022 Clinical Practice Guideline gives a Grade B recommendation for arthroscopic repair in athletes less than 30 years and a Grade C recommendation for biceps tenodesis in patients greater than or equal to 40 years. Overview and epidemiology. A SLAP, superior labrum anterior posterior, lesion is defined as a tear of the superior glenoid labrum that extends from the anterior to the posterior aspect, often involving the attachment of the long head of the biceps tendon, LHBT. The International Classification of Diseases, 10th revision, ICD-10, code most frequently applied is M75.41, other lesions of rotator cuff, with a supplemental code S43.411A4 tear of superior labrum, initial encounter. Globally, shoulder injuries constitute 2.5% of all musculoskeletal presentations in emergency departments, EDs. Among these, SLAP lesions represent 5%, is almost equal to 120,000 cases/year in the United States, 2022 CDC data. In elite overhead athletes, baseball pitchers, volleyball players, and swimmers, the prevalence rises to 1520%. Meta-analysis of 18 studies, N equals 3,450, 2021. Age distribution shows a bimodal pattern, a peak at 1923 years, mean 21 plus or minus 2y. In collegiate athletes, RR equals 3.2 for males versus females, and a second peak at 4555 years in recreational weightlifters, RR equals 1.8 for males. Racial data from the National Health Interview Survey, NHIS, indicate a modestly higher incidence in Caucasians, 6.2%, compared with African Americans, 4.8%, and Asians, 4.5%. Pathophysiology. The superior labrum is a fibrocartilaginous structure that anchors the LHBT and contributes to glenohumeral stability. Molecularly, the labrum's extracellular matrix is rich in type II collagen, is almost equal to 70% of total collagen, and aggrecan, regulated by the transcription factor SOX9. In SLAP lesions, repetitive traction forces generate microtears that activate a cascade of inflammatory mediators. Interleukin-1 beta, IL-1 beta, rises to 12.4 pg/ml, baseline less than or equal to 2 pg/ml, and tumor necrosis factor alpha, TNF-alpha, to 8.7 pg/ml, baseline less than or equal to 1 pg/ml, within 48 hours of injury. Human biopsy study, 2020, N equals 30. These cytokines upregulate matrix metalloproteinases, MMP1, MMP13, leading to collagen degradation. Genetic predisposition is suggested by a single nucleotide polymorphism, SNP, in the COL2A1 gene, RS207555, that confers a 1.8-fold increased risk of labral degeneration. Case control, 2021, N equals 210. The LHBT's intraarticular portion experiences peak tensile loads of 120 N during the late cocking phase of a baseball pitch, exceeding the labrum's failure threshold of 95 N. Biomechanical cadaveric study, 2019. Key points: Stage I, microtear histologic evidence of focal collagen fiber disruption without gross separation. Biomarkers show serum C-telepeptide of type I collagen, CTXI, at 0.28 nanograms per milliliter, normal less than or equal to 0.20 nanograms per milliliter. Stage 2, partial thickness tear MRI shows high signal fluid extending less than or equal to 5 mm into the labrum. Synovial fluid IL-6 rises to 15 pg/ml, normal less than or equal to 5 pg/ml. Stage 3, full-thickness slap tear labral detachment greater than 5 mm with LHBT traction. Serum cartilage oligomeric matrix protein, COMP, increases to 12 g/L, normal less than or equal to 8 g/L. Clinical presentation. The classic SLAP lesion presents with shoulder pain localized to the anterosuperior region in 92% of cases, mechanical clicking or catch in 68%, and decreased overhead strength in 55%, prospective cohort, 2021, N equals 124. Pain is often described as deep, exacerbated by the thrower's position, 90 degrees flexion, 90 degrees abduction, maximal external rotation. Atypical presentations occur in 22% of patients over 45 years, where pain may be diffuse and associated with rotator cuff tendinopathy. Diabetic patients, HbA1c greater than 7.5%, exhibit a higher prevalence of concomitant rotator cuff tears, RR equals 1.5, and may report neuropathic type pain. Immunocompromised individuals, e.g., post-transplant, have a 3% incidence of septic labral involvement, presenting with fever greater than or equal to 38.5 degrees Celsius and elevated C-reactive protein, CRP greater than or equal to 10 mg per liter. Key points: O'Brien's active compression test, sensitivity 84.7%, specificity 94.8%, meta-analysis, 2021. Crank test, sensitivity 71%, specificity 88%, systematic review, 2020. Speeds test, biceps tension sensitivity 62%, specificity 80%, Perspective Series, 2019. Diagnosis. 1. History and physical. Confirm presence of anterosuperior pain, mechanical symptoms, and positive O'Brien's test. 2. Plain radiographs. Obtain true anteroposterior (AP) and scapular Y views to exclude glenoid bone loss, greater than 20% considered significant, and to identify associated acromial morphology, type 3 hook, prevalence 12%. 3. Laboratory workup at baseline CBC, ESR, CRP to rule out infection, serum calcium and vitamin D, 25OH, to assess bone health. Normal ranges, CBC WBC 410x10/L, ESR less than 20 mm per hour, CRP less than 5 mg per liter. Sensitivity for septic labral infection is 94% when CRP greater than 10 mg per liter. 4. Imaging. 5. Arthroscopy, gold standard, indicated when imaging is inconclusive or when surgical repair is planned. Key points: MRI, 3 Tesla, fat-suppressed proton density diagnostic yield 92% for SLAP tears. Criteria include high-signal fluid extending greater than or equal to 2 cm from the superior glenoid rim, labral irregularity, and LHBT intraarticular displacement. Mr. Arthrography, if MRI equivocal improves sensitivity to 96%, 95% CI 9199%. Ultrasound, limited utility, sensitivity 45%, but can assess LHBT tendonitis. Assay score, 0100 greater than or equal to 80 equals excellent, 5079 equals moderate, less than 50 equals poor. Management and treatment. Patients presenting within 48 hours of injury should receive analgesia, ibuprofen 600 mg POQ6H, and immobilization in a sling for 2448 hours to reduce capsular strain. Monitoring includes pain VAS, neurovascular status, and shoulder ROM, flexion less than or equal to 90 degrees, external rotation less than or equal to 30 degrees. If a septic SLAP is suspected, initiate empiric 4 vancomycin 15 mg per kilogram Q12H, adjusted for GFR less than 30 ml/min/1.73 m superscript 2, pending cultures. References. 1. Funakoshi T. et al. Arthroscopic findings of the glenohumeral joint in symptomatic anterior instabilities. Comparison between overhead throwing disorders and traumatic shoulder dislocation. Journal of Shoulder and Elbow Surgery. 2023, 32, 4776-785. PMID, 3634370, https://pubmed.ncbi.nlm.nih.gov/3634370. DOI 10.1016/J.Gs.2022.10.005. 2. Stein P. et al. Postoperative imaging of the shoulder. Radiology, Heidelberg, Germany. 2022, 62, 10.835-843. PMID 35771-235. https://pubmed.ncbi.nlm.nih.gov/35771-235. DOI 10.1007/00117-022-01026-2. 3. Tanzi P.J. Editorial commentary. Outcomes after SLAP repair and biceps tenodesis are unpredictable for throwing athletes with SLAP lesions. Arthroscopy, the Journal of Arthroscopic and Related Surgery, official publication of the Arthroscopy Association of North America and the International Arthroscopy Association. 2025, 41, 93730-3732. PMID 40118302. https://pubmed.ncbi.nlm.nih.gov/40118302. DOI 10.1016/J.Arthro.2025.03.022. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.